I'm here with Dr. Madalina Petrescu from Evergreen Health, and I'd like to have you share, as a practicing cardiologist, the effects that stress has on the heart that you see with your patients.
Massive. What a great question, Donna. I love this question because, when patients come to see me for assessment of heart disease, I think a lot of times stress is literally left out, and a lot of times people go right to medications, and I am so passionate about the holistic approach. And such a big cause of cardiovascular morbidity and mortality and pathology is related to stress and anxiety. Stress and anxiety affects the heart in so many negative ways that we've talked about. First of all, when there is stress, what happens is that your nervous system gets activated and you develop all these stress-based emotions. And now you're flooded with a cortisol and adrenaline hormones, and all of that have a negative impact on the cardiovascular system. Number one, you can cause this vasoconstriction of the vessels. And so people can get really high blood pressures. I mean, I've seen people just from a negative, like a phone call, when they get so stressed around that, blood pressure can go from normal to like 200 systolic. Just from that. It is literally incredible to me. Or when the spasm happens in the vessels, it can even cause that in the heart vessels. So people can get chest pains and can even get heart attack from that. It's called coronary vasospasm. Stress is a negative contributor. Secondly, stress, when the stress hormones are flooding the body, it can cause arrhythmias. So people get all kinds of palpitations and arrhythmias, and that is a big cause.
So learning to manage your emotions really is a great way to regulate. Can you talk a little bit about, because I help people regulate their emotions and really work on their trauma, and if you can also address how past trauma, when it's unresolved, affects somebody's heart and health.
What an amazing, incredible question, because what I have noticed is, like I tell people too, we can't really change what happens in life. We can't really change the external circumstances, but what we can change is how we respond in a healthy way to the external factors that can create stress, so that we can respond in a way that is healthy. And so I think a lot of people are walking around with all kinds of emotions and traumas and past experiences that haven't quite been resolved, haven't quite been processed, and haven't been felt. And so as a result, people have all kinds of coping mechanisms, such as suppression and numbing and resisting and denying. And it's an illusion, because it doesn't go away. It actually gets worse because all of that gets pushed down into the body, and it becomes even more activated in the nervous system, and it shows up in the way that people are responding to their situations, in their family, in their relationships, when there's massive amount of stress that keeps on happening. Okay. So these don't go away, which is why I say to people all the time how important it is, developing healthy strategies and healthy ways to manage and to deal with lovingly, heartfully, with the stress-based emotions. And I think that there's just not a lot out there. There's just not a lot out there. People, will go exercise, or they'll go to a yoga class, or they'll take some medications. But I think it's important to get to the root of where is that coming from. And I think this is what you address, which is incredible, because if we can find a natural way to address that, then all of that flooding of the nervous system, flooding of the stress-based response can become diminished, and it doesn't have such a negative impact.
Yes, and through my work with patients and clients, I will teach people how to get into the parasympathetic pretty quickly. So when they're at an office visit with a doctor, if their blood pressure is really high, they can quickly, within 3-4 minutes, reduce their blood pressure, reduce their anxiety. Now tell us, there is a heart condition out there that's really a very serious heart condition, if you can.
I want to say, but you made such an important comment just now. I want to touch that a little bit. It is so incredibly important to recognize that healing cannot happen when somebody is in a nervous system overdrive. So healing, you need to get into the parasympathetic nervous system for healing to happen. And that was such a great point that you made, because when somebody's trying to heal themselves while being severely stressed, that's why it doesn't happen. That's why healing cannot happen until we are actually coming into the parasympathetic nervous system and accessing relaxation, and that's where all of these modalities can work. And there is actually a condition that is called stress cardiomyopathy. Stress cardiomyopathy. It is the real thing. I mean, we see this day in and day out, quite commonly at the hospital, where basically any kind of stress, whether it's physical or emotional, and there's a flooding of the stress emotions in the body, what can happen is it can actually result in the weakening of the heart muscle. So the heart muscle, which has a normal contractility, can weaken. And the weakening of the heart muscle results in an inefficient pumping. And people can develop something called congestive heart failure. And so this has really become increasingly recognized and is raising awareness of the importance of managing stress.
Thank you for sharing that. And I know you are really a big proponent of mind management, because this mind of ours is so powerful, and it's what I'm trained on. I teach neuroscience as a powerful tool to get into the subconscious, to change our thought patterns. So can you talk a little bit about that, on the importance of our mind management and healing your heart and any other disease?
Yeah, I think it's so important because a lot of the thoughts that we have, thought processes, belief processes, have a scarcity and negative bias. So even though people are not aware of it, they're walking around with negative thoughts and negative beliefs. And so if we're not aware, those are actually operating behind the veil and is driving our decisions and our choices and our stresses. And so getting a way to get into that and to support that, and that's a lot of it that I so believe in, is using our heart to support that process, so that we come out of the negative mindset in our mind and we start transforming and transmuting those thought processes, because we can do that.
Yes.
But we can only do that when we become conscious of that. So I think that's a really powerful approach. And I know that's something you're really passionate about.
Yes, I am. One of the practical tools that I teach people that work with me is to really get in touch with your heart. Because when you open up your heart and you feel those elevated emotions of love, joy, gratitude, it sends a message to your brain, and then your brain matches how your heart feels, and then it sends out chemicals matching that higher vibration, that elevated emotion, and that's when the body can start to heal itself.